Hey imposters, welcome to the high yield USMLE cases where we will cover different cases and their associated high yield facts you need to know for test day. I'm going to go over what each video will cover and how you can benefit from this collection. Time is tight for all of us, so you can view these videos in any style that works for you. I sometimes have a hard time getting out of bed, but watching something like this would make me feel semi-productive. Maybe even while I'm biking in the gym and feeling a little bit guilty that I'm not studying enough, I could listen and watch this while getting in some cardio. Okay, so the case study will always be presented in this area. They will be written similar to how they will show up on test day. This includes them being vague with sometimes high yield words or maybe annoying distractors. The purpose of this is to get you comfortable to the types of questions and styles you'll see on test day. I'll then have some primers here I want you to think about while reading the case. So for example, in this case, I want you to think about diagnosis, pathophysiology, presentation, and its treatment and or prevention. I thought about whether I wanted to make this collection in multiple choice format, but I think this way is a little bit better because on test day, you should be answering the majority of your questions by having an attack plan and not by eliminating answers, if that makes sense. Imagine you're a sniper. You would first want to kind of find the general area that you're in and then slowly inch into your answer and then, finally shoot at your target. So here's kind of what works for me. I first, of course, read the last sentence of each case. Then I would read the rest of the question here and then quickly glance at the answer choices that I'm given to kind of prime my brain. And I first tell myself, okay, so the general field, this is a genetics question. I then come up with a few differentials in my brain. So I'll say, hey, maybe this is DeGeorge syndrome, or let's say it's severe immunodeficiency syndrome based on the case. Then after that, I'll have a general idea of what's happening. I'll then think about what differentiates these two diseases and anything in the case that can help me eliminate one of the differentials I have. This might seem very tedious to do at the very, very beginning, but the more practice questions you do at the beginning with this mindset, it will become very automatic in your brain on how to tackle these questions. After I present the case, you can either pause the video to think about it or not. I will then show you concise notes on answering all of these on things that you should have thought about. And then, of course, I'll elaborate on them a little bit more. Many of us are very visual people, and I think studying for STEP can often make us forget what this disease could look like on a real person or in an image or under the microscope. And this has been true for many students where we tend to understand and memorize a disease that we've seen on an actual patient in clinic a lot better. This is the exact same reason why I will always include visuals here to help you create an image of what this patient should look like in your mind. So in this case here, we were presented with a peds patient with DeGeorge syndrome. I talk about the characteristic facial features here, some things we might see on imaging, some mnemonics that you can use. And I think this is an underrated way of going through questions on your test, which is forming a picture of the patient in your brain and then answering the question that way. So the purpose of this slide is to help you with that. Finally, I'll wrap everything up with a summary slide showing you again the case here, the concise notes, and I'll always let you know what field we're playing in, whether it's genetics, embryology, what disease, or medication, just so you know that general fields and as a sniper that I was talking about. I know a lot of us are big fans of first aid, so I will always include the different first aid pages here. Sometimes there'll be more than one listed here, and that's just because it shows up more than once in first aid, but you can usually trust the first or at least the second one will be the most high yield one for you to look at. Of course, I will end with our high yield munchies, which is essentially a concise educational objective of the entire case. If you find these concise notes helpful in any way, feel free to screenshot them along with the visual images slide and quickly run through them before testing. I could totally see that being helpful. As usual, I'll always paste any additional references in the description box, so feel free to use that. Let me know in the comments section if you have any questions or what topics you want to see on the next case. The objective of these videos is for you to load up with lots of ammo by exposing yourself to as many questions and styles possible so that when it comes to test day, you'll be able to shoot down any questions the USMLE throws your way. Please consider liking the video and subscribing. I'm trying my best to post as many helpful content as I can, but as you know, med students can get very, very busy and I'm doing this in my free time. Thank you so much for your support, and we'll talk next time. This is Imposter Med signing off, and as always, be happy and be kind.